Hi, I'm Dr. Tim Elder. I am a board certified family physician here in Gainesville, Florida, also in our High Springs, Florida office. So, heart disease pertains to pathology related to your heart. When we think of heart disease, typically we think about coronary artery disease, which pertains to vascular disease around the blood vessels to the heart. So we all know that family history is important if you have a family history of heart disease, high blood pressure, obesity, diabetes, tobacco use disorder. And these are just a few of them. And I think it's extremely important to understand if you have those risk factors and then try to work on ways, behavioral, different modifications, and discussing with your doctor about making sure that you have really good control of these risk factors to decrease your chance of developing heart disease. So it's really important to eat a healthy diet. There's lots of different diets out there that have been studied. And again, if you have questions about this, the American Heart Association is a great resource, as well as coming to see us for a regular routine visit to discuss options. But there's a lot of data on really good diet and how you can do that to really help decrease your chance of heart disease. A big thing is just get moving. Try to get exercise throughout your day. I'm a firm believer in at least getting 150 minutes of aerobic activity throughout the week, which is getting your heart rate elevated. I think also a really important time is trying to do it after dinner. Everybody tells me they don't have time during the day, they work, they're tired. But I feel like going and doing it right at the end of the day, especially after a big meal, I think is really good for not only your heart health, but also for kind of caloric expenditure and trying to help with your overall weight. What we eat is a lot of times how we were raised, and so kind of talking to people about that, sometimes it's a sore subject, but it's extremely important. And I apologize in advance for every time you go to the doctor we tell you to lose weight, but that's what we're just trying to do. We're trying to decrease your chance of heart disease and other comorbid conditions that would lead to heart disease by optimizing your body weight. I said one of the important things is at least getting a baseline blood pressure screen. And I think that's important to do intermittently, just to kind of keep an eye and understand what your normal blood pressure should be. So they've gone back and forth over the years, and currently we're trying to keep people's blood pressure under 120 over 80. And we know that significantly decreases your chance for vascular disease. But we used to just treat cholesterol as a number. Say your number is high, we treat you with a medication. Of course, medications have side effects. Obviously, we'd be doing it for the beneficial aspect of it and decreasing your chance for heart disease. But now the American Heart Association really has made a risk calculator tool, which makes it a little bit easier, and that takes in other risk factors that you have. And we make recommendations based on cholesterol medications to lower them based on what your risk factor is. And it's actually something you can go online to the American Heart Association's website, you plug in your data, and it'll tell you what your risk factor is and whether you should be on a cholesterol medication or not.